Okay, thank you, Dr. Langerman. And thank you to all the speakers. There have been some incredible projects presented today, and so I'm thrilled that this has been put together and to be part of this. One of my passions is in education, and until some of our colleagues mentioned today perfect their AI, we still have to find a way to teach and learn just an incredible amount of information as physicians. So I'll be presenting on just one aspect of that, the RADiENT curriculum. And I, of course, want to start with shouting out my team. You know, I even though I'm the one talking, I don't want anyone to get the idea that this was a solo creation. So, of course, Dr. Courtney Tomlinson in radiology, one of our attendings, and Dr. Langerman as well, were incredible mentors and creators here in this project. I also want to shout out my co-resident colleagues, Dr. Patro in ENT, as well as Dr. Todd and Dr. Breland in radiology. We also were able to get a small grant for this through the RSNA Radiology Society that they helped fund the development portion of the curriculum I'm going to describe. So really the goal of this curriculum was to take residents who are often siloed in their own program. So radiology residents learn radiology specific information from fellow radiologists. ENT residents often learn specific information from ENTs, and medicine in general ends up in these various silos. And we really wanted to break that down and create a curriculum that would combine residents into an educational model that would allow for more effective collaboration and interdisciplinary training. So we set out to design, develop, implement, and then evaluate, of course, one of the key steps in any new model, this curriculum for both radiology and ENT residents. The structure of this curriculum, you can see on the right of the screen, we had 10 sessions that we put together. The focus of this curriculum was specifically on radiology as it relates to the head and neck. And we had 6 of these learning sessions in person, and additionally 4 were asynchronous or done not in person. One of the things we wanted to trial with this curriculum as well was, especially in the light of COVID and new technologies and going to virtual platforms such as this symposium, how effective can we be when we do asynchronous or virtual modules in addition to in-person learning? We created teams up front that were intentionally distributed across the programs. So we had ENT and radiology teams combined, as well as PGY level. So having, interns working with 4s and 5s, and intentionally having a variety of baseline knowledge combined with people who maybe had a more advanced knowledge set. This was a longitudinal curriculum. We launched it in 2021 in this summer, and then had the sessions spaced out over about 6 months. And we, from there, also had a small study design as part of this. We looked at our study cohort, which was specifically the Vanderbilt ENT and radiology residents who completed a baseline survey that included knowledge questions about specific head and neck imaging studies and clinical scenarios, as well as a post survey that asked those same clinical questions again. We also included questions about a variety of more subjective ideas, such as their comfort and confidence level related to interpreting these imaging studies, and their willingness or current amount of collaboration across specialties between ENT and radiology. We also had a control group that is still being studied, where we sent out the same surveys to other residents that were not part of the RADiENT intervention. This is just an example of some of the module-based clinical scenarios that we asked the residents to participate in. They were purposefully clinically relevant, and also ones that, for example, if you look at the image on the left of a oral cavity, this is something that maybe a radiology resident wouldn't be looking at every day. And so we purposefully wanted to include knowledge and context that would be different than what was currently being taught to some of the ENT and radiology residents. We also wanted to prompt a discussion about the various diagnoses among the team members. I want to present just a brief bit of our results. Overall, participants increased their knowledge scores by an average of 24%, and that reached statistical significance. Participants also reported being more confident in interpreting some of the specific imaging we focused on. In our pre-surveys, MRIs and cancer staging scans were flagged as particular areas of pain points of maybe less knowledge that our residents had. And both of those had an increased confidence in interpreting those types of scans that reached statistical significance as well. When it comes to the interdisciplinary aspect of this study, we also found that radiology resident comfort in discussing cases with their ENT colleagues and their likelihood to call their ENT colleagues both increased, which can help foster that interdisciplinary collaboration. Anytime you're doing a proof of concept pilot model, you also want to see what the feasibility and acceptability was. And we were thrilled to see that 100% of our respondents that participated in this RADiENT curriculum reported that they thought it improved their skills and positively benefited their clinical education. Almost 100%, about 92% thought the program should be offered on an annual basis. And, at the end of the day, we're all here for the patients. And so we also asked about subjective improvement in patient care. And there is 88% of folks who perceive that their patient care improved after participating in this program. To quickly touch on future directions, we are doing another iteration of this. We decided not to offer it annually, but rather on an every 2-year basis. So in the 2024 curriculum year, we will be doing another iteration of RADiENT. One of the aspects that I think could really benefit, especially if we're going to talk about expansion, is to be able to objectively show that this is better for patients by examining quality improvement metrics. For example, are we potentially reducing costs with improved imaging utilization in folks that have gone through this program? In addition, I think there's a wide variety of options for adaptability for others, not just within ENT and radiology. We would, of course, love to be able to have a package that can be marketed to other ENT or radiology programs so they could implement it among their resident education, but also in other combination dyads. For example, doing the general surgery folks along with the body imaging radiologists would be just one example of another expansion. And then finally, as we spoke earlier about kind of in proof of concept using some of the existing models that are there, the technology we used was fairly basic. And so I do think there's a wide variety of technologic optimization here, such as streamlining some of the modules and the clinical scenarios via app creation or push notifications. And thank you all for your time.
Again, we're just adding to the list of amazing work and presentations that we've seen here this morning. So thank you so much for giving this presentation. I do want to say that I really appreciate your reporting of the outcomes. I think that's a really great approach. And so there's great appreciation for that. I do have a question. How are you currently, or how do you foresee paying for or providing support for this program, for curriculum? I want to extend off the questions that Dina asked previously, because the same situation exists for you. How do you make sure that your program remains financially sustainable in the long term?
Absolutely. And that is definitely a question that we have addressed. Funding is always a tough aspect of any idea, and any sustainable funding, as you mentioned, is huge. The grant we got was a reasonable amount of seed funding. And so the curriculum as it stands for ENT and radiology right now needs very little financial maintenance, which is nice. And we kind of did that on purpose. Now, if we do want to expand, that of course would require additional seed funding. Some of the technology and adaptations I talked about would require additional funding. Certainly there are within ENT, our own academy, within radiology, within the broader ACGME, there are additional grants and seed funding that we could apply for. I think we do have a reasonable proof of concept, and I think that is certainly an area. I know the Robert Wood Johnson Foundation has some educational initiatives as well. So, and then the other direction outside of grants and educational funding is, as several people have talked about, is commercialization. Who could buy this? And that is an area that I have personally not explored as much, but that is certainly another next step. Is could we find a potential customer either in the departments or the academy that would be willing to buy this package.
Well, let's ask one. Let's go in another direction, but a similar direction. You talked about potentially distributing this to other places. What was your approach, or what is your approach to doing that?
Yeah, that is a great question. We haven't done any distribution yet. We've had some discussions just to see, I forget who spoke about consumer interest earlier and just consumer discovery. So I think that's where we are right now, is kind of at the our initial idea of, are the residents open to this? We've kind of checked that box. And so now we're in the discovery model of our other programs open to this. And so far there's been a lot of interest. And then I think it comes down to, how do we best distribute things while still making it sustainable? And also, I do think, we haven't talked about this, but I think protecting IP as well. A lot of work has gone into designing this, and I think we want to maintain that as well.
Well, a few notes I would love to point out is, number one, don't be afraid to go out and ask some of these people what their problems and their challenges are, because they may reveal to you that their problem and their challenge might be solved by something you're working on. So don't be afraid to go and ask those open-ended questions, because you might just stumble into a potential customer, right? And if you're meeting potential customers, those are potential sources of revenue to keep your approach financially sustainable. And also feel free to lean on some of the people in this Zoom room. When you talk about IP, we've got IP here. When you talk about understanding how to distribute curriculum, Dina has done that. So you've got resources here that you can reach out to, and we want to see you and everyone here successful. So excellent work thus far, Dr. Stevens. Excellent work.
Thank you. I appreciate you taking the time today.